specific humanitarian pauses and suspension of evacuation orders for the implementation of a 2-round polio vaccine campaign set to begin on the 1st of September in the Gaza Strip. During each round of the campaign, the Palestinian Ministry of Health, in collaboration with WHO, UNICEF, UNRWA, and other partners, will provide 2 drops of WHO pre-qualified novel oral polio vaccine type 2, NOPV2, to more than 640,000 children under 10 years of age. The first campaign has a phased approach, starting with central Gaza, followed by South Gaza, followed by North Gaza, each area covered over 3 days. This agreement is a testament to our collective commitment to overcome barriers and protect every child from polio. We stress the critical importance for all parties to adhere to the commitments that have been made. 1.26 million doses of vaccines and 500 vaccine carriers have been delivered to Gaza, with 400,000 additional doses to arrive soon. Over 2,000 health workers and community outreach workers have been trained to provide vaccination and to inform communities about the campaign. At least 90% of coverage is needed during each round of the campaign in order to stop the outbreak and prevent international spread of polio. Due to insecurity, damage to roads and infrastructure, and constant population displacement, and the highly constrained operating conditions, conducting the campaign for just 3 days in each area is unlikely to be sufficient to achieve adequate vaccination coverage. Vaccination coverage will be monitored throughout the campaign, and it has been agreed that vaccination will be extended by 1 day wherever necessary to vaccinate all children. From our experience, we know an additional day or 2 is very often needed to achieve sufficient coverage. The pauses will allow children, families, and health workers to move safely, ensuring that vaccines are administered efficiently across all zones. The safety of every single one of the 2,180 vaccinators must be guaranteed. Their security is paramount. We urge all parties to ensure their protection, as well as that of health facilities, children, and their families. The polio outbreak is occurring within a much larger public health catastrophe. As of the 25th of August, only 44% of 132 primary healthcare facilities are functioning. Only 17 out of 36 hospitals are providing services, and these are only partially functioning. The functionality of health systems is compromised by physical damage, lack of fuel, limited medical supplies, and loss of staff. As of the 23rd of August, there are 9 operational field hospitals, 2 in Deir al-Balah, 5 in Khan Yunis, and 2 in Rafah. Hospitals in the north are facing dire shortages of fuel. Yesterday, WHO managed to reach the Indonesian hospital to deliver fuel, while in the last 2 weeks, only one of WHO's 6 requested missions was facilitated to deliver fuel and medical supplies to northern Gaza. While the health system has been massively degraded, attacks on healthcare continue to be reported. From the 7th of October to 22nd of August 2024, WHO documented 1,098 health attacks in the occupied Palestinian territory, 492 of which occurred in Gaza, resulting in 747 fatalities and 969 injuries. Evacuation orders are further disrupting healthcare provision, endangering critical health infrastructure, and hampering the delivery of essential supplies. 11 hospitals, 17 primary healthcare centres, and 51 medical points have been directly affected by multiple evacuation orders, resulting in the loss of approximately 1,300 beds. The closure of 3 centres for the management of severe acute malnutrition also puts acutely malnourished children at further risk of life-threatening crises. Despite these challenges, WHO and its health cluster partners and emergency medical teams continue to deliver healthcare on the ground. 63 health cluster partners are currently operating in Gaza, reaching a weekly average of 338,000 people with various health services and supplies. 15 emergency medical teams are currently operating in Gaza, running primary healthcare facilities, field hospitals, and reinforcing existing hospitals with specialized services such as surgery. Close to 1.4 million consultations have been provided by EMTs to date. 242 primary healthcare service points are currently operated by partners. Medical evacuations of patients outside Gaza remain severely limited, with only 122 patients evacuated since the 7th of May. Out of 14,192 cases requested for medical evacuation, only 5,012, 35%, have been evacuated since October 2023. Of utmost urgency is the restoration of medical evacuations from Gaza to the West Bank, including East Jerusalem, where hospitals are ready to receive patients. Patients must also be facilitated to be transferred to Egypt and Jordan, and from there to third countries when needed. WHO appeals for the establishment of multiple medical evacuation corridors to ensure sustained, organized, safe, and timely passage of patients via all possible routes, including Rafah and Kerem Shalom. The destruction of water, sanitation, hygiene, wash infrastructure has contributed also to the spread of infectious diseases. With 67% of Gaza's wash infrastructure damaged or destroyed, and with only minimal access to clean water, rates of diarrheal diseases have increased significantly. Over 25% of the population are suffering from water and sanitation-related diseases, including bloody diarrhea, hepatitis A, and skin diseases such as scabies. Other epidemic risks are also on the rise due to continued displacement and worsening living conditions. The situation in the West Bank is also deteriorating, with increased military actions and restrictions of movement severely hampering access to healthcare. Roads near Jenin, Ibn Sina, and Al-Razi Hospital have been bulldozed. Military presence in the vicinity of the Jenin Government Hospital is deterring patients from seeking healthcare. In Tubas and Tulkaram, movements of health workers and ambulances while trying to reach the injured were obstructed. The disruption of ambulance services and the obstruction of patients' access to hospitals further threatens the lives of those in urgent need of care. The world cannot stand by as Gaza's health system crumbles under the weight of this conflict. The international community must act now to secure humanitarian pauses, ensure the delivery of critical health supplies, and support the rapid implementation of the polio vaccination campaign, which needs to also mark a significant change on how humanitarian response in Gaza is delivered. Aid needs to be delivered at a much larger scale and at a much faster pace without any hindrance. Failure to act will have catastrophic consequences, not only for the children of Gaza, but for the population of the region and the world. The call for an immediate and sustained ceasefire resonates more strongly than ever. We have a narrow window of opportunity to avert further public health calamity. The commitment to stop the spread of polio must be replicated for all public health risks. And Chair, just with your indulgence, I would just like, on behalf of the polio community and the UN community, like to dedicate our work in the coming days to our colleague, Mr. Aidan O'Leary, who was the head of the polio program at WHO, worked for the UN, led OCHA in Iraq and in Yemen, worked in the Balkans, was the best of us, the best of WHO, the best of UNICEF, the best of OCHA, the best of the UN. And we would like to dedicate our work in the coming days, not only to saving the lives of the children of Gaza, but to his memory. Thank you.
I thank Dr. Ryan for his briefing. I now give the floor to those council members who wish to make statements. I give the floor to the representative of United Kingdom.
Thank you, President. And let me thank Under-Secretary General Masia and Deputy Director General Ryan for their briefing, and also, once again, for the vital work of their staff. The UK, alongside Switzerland, called this humanitarian meeting after yet another alarming warning from the UN. The situation in Gaza is intolerable and worsens with each day that passes. Over 100 hostages remain trapped in Gaza, subject to unimaginable horror. We reiterate our call for Hamas to immediately release them and for ICRC to be granted humanitarian access. And Palestinian children, already suffering, are now facing the imminent threat of a major polio outbreak caused by the devastation of water and sanitation services, as well as widespread malnutrition and famine risk in Gaza. A 10-month-old baby has already been paralyzed by this disease, the first such case for 25 years. This is a tragedy that could have been prevented. As we've heard, the UN plans to deliver vaccines as soon as this weekend. We strongly welcome Israel's agreement for pauses on military operations so that the World Health Organization and health agencies can deliver a safe and effective campaign. We now need to see this in action, and these pauses need to be long enough to deliver the 90% coverage required. When the campaign starts and thousands of vulnerable and unaccompanied children gather at vaccination sites, they must all be protected. Israel's ramping up of short-notice evacuation orders, including in areas that should provide safe refuge, is causing more chaos, again leaving Palestinians with no safe place to turn. The UN Department of Safety and Security this week warned us that the UN too is running out of safe places for its staff. They cannot deliver desperately needed aid when IDF mass evacuation orders force them to uproot their homes and offices with just a few hours' notice. Israel must minimize evacuation orders and provide sufficient notice of at least 48 hours. And despite repeated calls by this Council for deconfliction and the protection of aid operations, we continue to see appalling and unacceptable attacks on UN and aid convoys. This conflict already represents the deadliest by far for humanitarian personnel. Just this week, the UN confirmed that the IDF opened fire on a World Food Programme truck which had been fully coordinated with Israel and had UN workers inside. Israel must take immediate steps to protect aid workers. And if its personnel are responsible for incidents, hold them accountable. All parties must abide by their obligations under international humanitarian law. Sadly, President, it's not only in Gaza where we're witnessing violence. We are deeply concerned by rising levels of violence in the West Bank. Over 130 Palestinians, including 26 children, have been killed this month alone. We join the Secretary General in calling for urgent de-escalation. Colleagues, the only way to bring an end to this suffering is an immediate ceasefire. We fully support the ongoing efforts of the US, Egypt, and Qatar to reach an agreement on this which will get all the hostages out and significantly more aid in. We call on both Israel and Hamas to urgently take the deal on the table. We must then see irreversible steps towards a two-state solution, the best means of ensuring long-term peace for Israelis and Palestinians alike. Thank you.
I thank the representative of the United Kingdom for their statement. I give the floor to the representative of Switzerland.
Merci, Monsieur le Président. Et comme mon collègue britannique, je voudrais commencer par remercier la secrétaire générale adjointe aux affaires humanitaires ad interim, Joyce Msuya, et le directeur exécutif chargé du programme OMS de gestion des situations d'urgence sanitaire, Mike Ryan, de leur présentation, des informations, mais surtout aussi du courage inlassable de leurs équipes qui travaillent dans les situations les plus difficiles, souvent risquant leur vie. La Suisse a demandé la convocation de cette séance aux côtés de la Grande-Bretagne parce que les conditions de sécurité ne permettent pas aux humanitaires de faire leur travail. Ceci est inacceptable, a fortiori alors que la situation humanitaire s'aggrave de jour en jour. Il y a 4 mois, ce Conseil a adopté la résolution 2730 que la Suisse a eu à cœur de rédiger. Un nouvel incident à Gaza nous rappelle la pertinence urgente de cette résolution. Le programme alimentaire mondial travaillait sur sa mission d'acheminement de la nourriture indispensable à la survie des civils lorsque ses véhicules et son personnel ont essuyé des tirs. Nous venons de l'entendre aussi de Mme Souya. Nous sommes également très préoccupés par le fait que les ordres d'évacuation, ordres qui, selon le droit international, devraient servir à protéger la population et notamment se dérouler dans des conditions adéquates en termes d'hygiène, de santé, de sécurité, d'abri et de nutrition, résultent en effet le contraire. Avec les hostilités, les ordres de l'armée israélienne ont jusqu'à aujourd'hui causé le déplacement de près de 90% des habitantes et habitants qui vivent sur moins de 11% de la bande de Gaza, dans une petite zone surpeuplée, polluée et dangereuse, où les services essentiels sont limités, notamment les installations médicales, les abris et les puits d'eau. En plus de déraciner des familles déjà épuisées, dont de très nombreux enfants, ces ordres posent d'énormes obstacles aux activités humanitaires. Les actrices et acteurs humanitaires perdent ainsi l'accès aux locaux et aux infrastructures logistiques indispensables pour opérer, comme ce fut le cas dans la nuit de dimanche à lundi à Deir al-Bala. La Suisse appelle toutes les parties à respecter leurs obligations en vertu du droit international et notamment à respecter et protéger le personnel humanitaire ainsi que ses activités. Toutes les parties ont l'obligation d'autoriser et de faciliter l'accès humanitaire rapide et sans entrave à tous les civils dans le besoin. Cela s'applique donc également aux groupes armés tels que le Hamas. De plus, la Suisse rappelle qu'Israël est, en tant que puissance occupante, et tel que rappelé par la Cour internationale de justice, tenu de répondre aux besoins humanitaires de la population. Conséquence des conditions catastrophiques à Gaza, nous l'avons entendu, la polio y a refait surface. Il est impératif que la campagne de vaccination planifiée par l'ONU soit menée à bien dans la sécurité la plus complète pour le personnel humanitaire et les civils, notamment les 640 000 enfants de moins de 10 ans qui doivent être inoculés dès samedi. La Suisse soutient la campagne de vaccination avec un financement d'1 million de francs suisses. Le secrétaire général a clairement indiqué que les armes doivent se taire pour permettre à l'ONU de procéder aux 2 phases de vaccination nécessaires. Et ce Conseil a unanimement exigé un cessez-le-feu à Gaza et la libération des otages par ses résolutions 2728 et 2735. Nous soutenons la médiation de l'Égypte, du Qatar et des États-Unis. Dans le même temps, nous devons réaffirmer notre exigence d'un respect du droit international humanitaire en toutes circonstances et par toutes les parties. Même en l'absence de cessez-le-feu, le travail humanitaire doit pouvoir se poursuivre. La Suisse salue le travail de l'ONU et de ses partenaires dans ces conditions extrêmement difficiles. Ce Conseil doit rester informé de la conduite de la campagne de vaccination et, le cas échéant, se tenir prêt à agir. Monsieur le Président, la Suisse est également très préoccupée par l'escalade en Cisjordanie qui atteint une nouvelle dimension. Nous observons la forte augmentation des opérations israéliennes, y compris des frappes aériennes en zone densément peuplée, comme ces derniers jours à Jenin et Tulkarem notamment. Cela a aussi comme conséquence de fortes restrictions de mouvement, y compris celles imposées au personnel médical. Il est inacceptable que là aussi, les services de base à la population soient régulièrement coupés. Nous appelons Israël à respecter ses obligations de droit international. En particulier, l'usage de la force doit notamment répondre aux critères de nécessité et de proportionnalité et respecter le droit de tout individu à la vie et à la sécurité de sa personne. Pour conclure, le respect respect du droit international et des résolutions de ce Conseil est de plus une condition sine qua non pour la désescalade, y inclut la désescalade régionale et un premier pas vers la mise en place d'une paix durable entre Israéliens et Palestiniens. Nous réitérons notre soutien ferme à la solution négociée à deux États, Israël et la Palestine, dont Gaza fait partie intégrante, et vivant côte à côte en paix et en sécurité, à l'intérieur de frontières sûres et reconnues. Je vous remercie.
I thank the representative of Switzerland for their statement. I give the floor to the representative of the United States.
Thank you, Mr. President. And thank you, OCHA Assistant Secretary General Masuya and WHO Director General Ryan, Deputy Director General Ryan, for your briefings. Polio is a scourge of a disease, one that had nearly been eradicated through the dedicated efforts of agencies like the World Health Organization, UNICEF, and other global health partners. The return of confirmed polio cases in Gaza is a clear and present threat to the health of the most vulnerable Palestinian civilians, including children, who have suffered terribly since this conflict began over 10 months ago. There is no doubt as to the threat that polio represents to the region and the importance of establishing the conditions need to urgently implement a vaccination campaign throughout Gaza. For that reason, the United States is grateful to the UN for its leadership and urges all parties to support a safe and successful campaign. We continue to support coordination between the humanitarian community and Israeli authorities to facilitate swift implementation of a vaccination campaign in Gaza. Secretary Blinken raised this during his recent visit to Israel. It is vital that this campaign be implemented without delay. It is especially important for Israel to facilitate access for agencies carrying out the vaccination campaign and for it to ensure periods of calm and refrain from military operations during vaccination campaign periods. We urge Israel to avoid further evacuation orders during this period. The bottom line is that humanitarians on the ground, including UN agencies and other NGOs, must be provided the space and security conditions to distribute vaccines and inoculate the at-risk population, and to do so safely. Children's lives depend on their success. The need is urgent. Colleagues, the polio campaign is yet another example of humanitarians working under extraordinarily difficult circumstances to help the people of Gaza. We are grateful for their sacrifices and tireless work, and we will continue to insist on the need for their protection in Gaza and around the world. Even as we press all parties to facilitate life-saving work, we must not ignore how Hamas's actions continue to put civilians, including humanitarian personnel and their families, at risk. Separately, we are alarmed by yesterday's reports that the IDF fired repeatedly on a WFP vehicle. Israel has said it is investigating this most recent incident, which their initial review has said was a result of a communication error between IDF units. We have urged them to immediately rectify the issues within their system that allowed this to happen. Yet the simple fact is, almost 11 months into this conflict, incidents such as yesterday's remain all too common. We are also concerned by another incident in which the IDF fired toward a UNICEF vehicle. These security incidents make the work of these organizations significantly harder. These incidents should not happen. Israel must not only take ownership for its mistakes, but also take concrete actions to ensure the IDF does not fire on UN personnel again. Further, all attacks and threatening rhetoric against the UN and humanitarian NGOs need to stop. The rhetoric has placed and continues to place humanitarian actors under increased risk, both in Gaza and globally. Colleagues, today's briefings underscore the vital importance of finalizing a ceasefire with the release of hostages, as this Council called for in Resolution 2735. The United States, in partnership with Qatar and Egypt, continues to engage the parties on a final deal, which would bring the hostages home and bring much-needed relief to the people of Gaza. A ceasefire hostage release agreement would also aid efforts to alleviate the public health crisis in Gaza, which extends beyond polio to outbreaks of cholera and suspected hepatitis A, all of which are avoidable. The international community must also do its part. We reiterate our call on all member states to contribute funds to support the life-saving work of humanitarian organizations in Gaza. The level of human suffering in Gaza is immense, and Palestinian civilians, many of whom have been displaced multiple times, continue to bear the worst of catastrophic humanitarian conditions. But again, the best course to alleviate the suffering of the Palestinian civilians and of Israelis awaiting the safe return of their family members is to finalize and implement a ceasefire. The time is now. Thank you, Mr. President.
I thank the representative of the United States for their statement. I give the floor to the representative of China.
主席，我感谢瑞士和英国倡议召开此次会议，也感谢姆苏雅助理秘书长和瑞安副总干事的通报。加沙冲突爆发10个多月以来，已经造成4万多平民死亡和前所未有的人道灾难。尽管国际社会一再发出停火止战的强烈呼声，安理会为此通过多份决议，国际法院发布了临时措施命令，但局势没有丝毫好转，仍在不断恶化。仅仅在过去1个月，战火就又夺去了1000多名加沙民众的生命。以色列发布了16次紧急撤离命令，大量民众聚集的学校、难民营成为了袭击目标，数十万民众被迫一再逃离，却找不到栖身之地。以色列持续加大对联合国等人道机构的打压限制，频频拒绝燃料等物资的运输。近日，人道机构被迫从戴尔巴拉赫的援助中心和仓库撤离，加沙人道援助系统进一步遭受了严重冲击。脊髓灰质炎病毒严重威胁加沙儿童的身体健康。接种疫苗是遏制病毒传播、保护儿童生命的最有效手段。病毒传播没有国界，中方支持古特雷斯秘书长的呼吁，敦促以色列本着对本国以及地区儿童生命负责的态度，为开展疫苗接种提供安全保障和便利。我们支持安理会就此发出强烈呼吁，避免加沙的人道危机进一步恶化。在约旦河西岸，以色列持续违反国际法和安理会决议，不断扩张定居点，加大对巴勒斯坦人的搜查、抓捕和袭击。去年10月以来，已有620多名巴勒斯坦人丧生。昨天，以色列军队向约旦河西岸图勒凯尔姆、杰宁、图巴斯等地发动大规模袭击，造成至少10人死亡和多人受伤。中方对此强烈谴责。以色列政府高层人士最近放风称，要在约旦河西岸采取同加沙一样的行动。 我们对这种冒天下之大不韪的言论表示震惊和严重关切。加沙现在已经变为人间地狱，我们绝不能让加沙的人道惨剧在约旦河西岸上演，让约旦河西岸变为另一个人间地狱。中方反对任何加剧紧张的言行，谴责一切针对平民的袭击行为，呼吁有关各方，特别是以色列方面，保持冷静克制，防止局势进一步升级。主席，当务之急是全面落实安理会围绕加沙局势通过的4份决议，推动立即实现加沙持久停火，切实缓解加沙人道灾难。停火谈判不能无限期拖延下去，更不能以谈判为幌子，继续在加沙和约旦河西岸实施违反国际法的暴行。中方敦促以色列立即停止在加沙的一切军事行动，开放全部过境点，停止对联合国等人道机构的打压限制，停止对约旦河西岸的袭击，遏制定居者暴力，结束有罪不罚。对当事方有重要影响的国家，应拿出真诚负责的态度，采取切实行动，推动实现停火。我们支持安理会为推动落实有关决议，早日平息战火，缓解人道灾难，采取进一步的行动。谢谢主席。
I thank the representative of China for their statement, and I give the floor to the representative of Republic of Korea.
Thank you, Mr. President. My gratitude also goes to Acting USG, Ms. Joyce Msuya, and the WHO Deputy Director General Dr. Ryan for the detailed briefing on the dire humanitarian situation in Gaza. With over 280 humanitarian workers killed since the deplorable Hamas attacks against Israel on October 7th, we are reminded once again that nowhere and no one in Gaza is safe. Not UN staff, not civilians, not medical workers, and certainly not children, who comprise half of Gaza's population and are now even at risk of polio. In this regard, I'd like to make the following points. First, we are seriously alarmed at ongoing threats against both civilians and the UN and humanitarian personnel in Gaza, particularly in and around Deir al-Balah, Gaza's most vital humanitarian hub since the former safe zone in Rafah was destroyed. Recent increased IDF operations there, including the ongoing targeting of schools, sheltering families, have resulted in numerous civilian deaths and the forced displacement of tens of thousands into concentrated areas along the sea with scant access to humanitarian needs. My delegation is deeply disturbed to see the August 27th incident where a clearly marked WFP convoy was riddled with bullets, and the WFP's resulting suspension of its operations in Gaza. We appeal to Israel and all parties to the conflict to allow UN personnel and humanitarian workers to do their job safely. Second, the Republic of Korea is gravely concerned by the sharp increase in evacuation orders by Israel, including at least 16 issued in August alone, according to OCHA. This not only adds torment to a hungry, sick, and exhausted population subject to multiple displacements, but also, as USG Michaud highlighted in his August 27th statement, imposes unbearable threat to the safety and security of UN personnel and other humanitarian workers. Such risk significantly impedes the safe and unhindered delivery of humanitarian assistance at scale in Gaza, where 500,000 people facing catastrophic food insecurity levels. Third, we are extremely disturbed by the polio outbreak in Gaza, which significantly threatens Palestinian children due to its highly contagious nature. In this regard, we strongly support the urgent vaccination efforts to be conducted by UN agencies, including WHO, scheduled for next week. We call on all parties to let health workers fulfill their vital mission of protecting Gaza from a virus that hadn't had an outbreak for 25 years. Mr. President, the bleakness of the current humanitarian situation in Gaza for its 2.3 million people is simply intolerable. Council resolutions remain unimplemented and the deconfliction mechanisms are ignored. At the same time, the wider region's security hangs perilously on a knife edge. With this in mind, the Republic of Korea reiterates its urgent appeal to the parties to finally secure a long overdue ceasefire agreement and also to de-escalate growing tensions in the West Bank and beyond. I thank you.
I thank the representative of the Republic of Korea for their statement. I give the floor to the representative of Ecuador.
Gracias, presidente, y agradezco a la señora Msuya y al señor Ryan por sus ilustrativos informes de esta tarde y por su conducto. Deseo reiterar el apoyo del Ecuador a la labor de las Naciones Unidas y de todas sus agencias. Los esfuerzos realizados por el personal de la ONU para aliviar la situación humanitaria de la población civil en Gaza, a pesar de todas las dificultades, demuestran que esta organización es valiosa y necesaria, y su trabajo es irreemplazable, sobre todo en tiempos de crisis. Los Estados miembros de Naciones Unidas debemos colaborar con esta, que es nuestra organización, facilitar sus labores en la medida de lo posible y como mínimo no poner obstáculos a su trabajo. Por esto, es preocupante lo señalado por el secretario general adjunto y jefe del Departamento de Seguridad, Gilles Michaud, el 27 de agosto, pues el personal humanitario debe ser protegido. Las partes están obligadas a respetar las normas del derecho internacional humanitario siempre y en todas las circunstancias. Los compromisos adquiridos en virtud de la Carta de las Naciones Unidas para garantizar la seguridad de los locales de la ONU deben ser honrados. Señor presidente, colegas, en cuanto a la situación sanitaria, reitero lo señalado la semana pasada. El Ecuador apoya la iniciativa de Naciones Unidas de organizar una campaña de vacunación masiva para proteger del polio a los niños en Gaza. La inacción sobre enfermedades prevenibles es inadmisible. Es urgente e indispensable que las partes den todas las garantías de seguridad necesarias para iniciar la campaña en la fecha prevista y para que ésta se desarrolle sin interrupciones. De la misma forma, reitero el apoyo de mi país a los esfuerzos que siguen en curso para alcanzar un acuerdo que permita un cese al fuego inmediato, la liberación de los rehenes y el mejoramiento de la situación humanitaria en Gaza, incluyendo la campaña de vacunación. Es de primordial importancia que este acuerdo se dé sin más demora. Desde los ataques terroristas perpetrados por Hamas el 7 de octubre, que el Ecuador una vez más condena, la violencia no se ha detenido Es hora de parar esta dinámica. Concluyo, señor presidente, reiterando, como en muchas otras ocasiones, el compromiso de mi país con una solución pacífica, negociada, definitiva y justa para las partes, con la existencia de dos estados, Palestina e Israel, sobre la base de las fronteras de 1967 y de las resoluciones relevantes.
I thank the representative of Ecuador for their statement. I give the floor to the representative of Guyana.
Mr. President, let me begin by thanking the delegations of Switzerland and the United Kingdom for requesting this timely briefing. I also thank Acting USG Masuya and WHO's Deputy Director General Dr. Ryan for their critical updates on the situation in Gaza. As illustrated again by our briefers, the humanitarian situation in Gaza becomes increasingly catastrophic with each passing day, engendered by a man-made crisis of unprecedented proportions. The violations of the occupying power continuously reach new levels in the face of this Council's inaction to stop this trampling of everything that the United Nations was built to achieve. History will judge us harshly if this Council does not act to save the Palestinian people from the scourge of this unending onslaught in flagrant violation of the United Nations Charter and international law. Guyana therefore appeals to fellow Council members for us to act collectively and urgently to bring a swift end to the hostilities in Gaza and to halt the toll of death and destruction. We remain deeply distressed by the conditions under which humanitarian actors, including UN personnel, are operating in Gaza. The statement issued on Tuesday by the UN Deputy Department of Safety and Security sets out some of the challenges associated with the UN's aid operations in Gaza, noting that the organization, and I quote, is operating at the uppermost periphery of tolerable risk, end of quote. This was evident in the IDF's shooting of a marked and deconflicted WFP vehicle on Tuesday evening. Broadly speaking, it is the wanton disregard for and violations of international humanitarian law that allowed these incidents to continue. We have also taken note of how the constant evacuation orders, sometimes with very little notice, are affecting humanitarian operations, including by shrinking the spaces both in which they operate and in which civilians dwell. On this latter point, Guyana notes, for example, that prior to 7th October 2023, there were 1,200 persons per square kilometer in Gaza, and that number has currently risen to 30,000 to 40,000 persons. One consequence of these constant evacuations and shrinking space for civilians is that people have been forced to endure living conditions that are giving rise to disease. For example, polio has reemerged in Gaza after 25 years. The WHO's collaborative efforts to vaccinate Gaza's children against this disease should be allowed to take its course in the interest of children throughout the region. As Mr. Philippe Lazzarini reminded us recently, polio will not distinguish between Palestinian and Israeli children. Delaying a humanitarian pause will only increase the risk of its spreading. Mr. President, we cannot ignore the worrying developments in the West Bank. We have taken careful note of OCHA's report of wide-scale Israeli operations, including drones and ground forces in some governorates, end of quote, in West Bank. The actions of the Israeli security forces patently undermine the quest for a two-state solution, contrary to resolutions adopted by this Council and the General Assembly, and aggravate the risks to peace and stability in the region. These actions contravene the advisory opinion issued by the International Court of Justice, in which the court pronounced on the illegality of the ongoing Israeli occupation of Palestinian territory and on how this occupation undermines and imperils the two-state solution. Against this backdrop, Guyana reiterates 4 appeals. First, we call for an immediate and unconditional ceasefire. Since its first days, the incessant bombing campaign has exceeded anything that could be considered a proportional response. What we are witnessing instead is an unprecedented and an unrelenting war on innocent civilians. The urgency of reaching a ceasefire deal now cannot be overemphasized. On 10 June 2024, this Council endorsed a 3-phase ceasefire proposal with the expectation that the parties would have shortly thereafter agreed to the proposal. With nothing forthcoming more than 10 weeks later, this Council must seriously consider how it could ensure an immediate ceasefire in the context of its own responsibility to protect innocent civilians from genocide. Second, Guyana calls for the immediate and unconditional release of all hostages taken captive on 7th October and of all Palestinians detained in Israeli jails without charge and for some years, and some for years. Simultaneously, we call on the relevant parties to treat all hostages and detainees with dignity and respect. Third, Guyana stresses the critical need for adequate humanitarian access into Gaza. The civilian population is being crushed under the tremendous weight of needs existing in Gaza, while essential supplies, including food and medicine, are sitting in trucks outside of Gaza, wasting away owing to restrictions on access. We therefore call on the Israeli government to prioritize the well-being of civilians in Gaza, not as some measure of goodwill, but as a legal and moral imperative. Finally, Mr. President, Guyana underscores that justice and accountability are integral elements of any day-after discussions. The desire for justice is innate in every human being, and there must be accountability for the injustice experienced by every Palestinian, not just since 7th October, but also in the decades preceding. A strong message must be sent to all violators of international law that their actions would not be clothed in impunity. I conclude by urging every one of us around this table to consider how we can, individually and collectively, pave the path to peace for Palestinians and Israelis and for the entire Middle East, whose civilians continue to be caught up in the throes of a war, neither of their making nor choosing. I thank you, Mr. President.
I thank the representative of Guyana for their statement. And I give the floor to the representative of Slovenia.
Thank you very much, Mr. President. I also want to thank the briefers, Ms. Masuya and Dr. Ryan. Mr. President, a long time ago, we exhausted our vocabulary of words to describe the tragedy of Palestinians in Gaza. It is difficult to comprehend and accept that such suffering of civilians, and especially children, has been met with impunity in front of our eyes almost for 11 months, and that we haven't been successful in stopping it. And we are sitting here again at another council meeting. So what has changed since the last briefing?
Given the scale of suffering, I could speak about record high numbers of killed, injured, maimed, displaced. Since our last meeting, a first case of polio has been confirmed. The life of 10-month-old Abdel Rahman and his family is likely changed forever. We would like to start by welcoming the efforts and work of WHO, UNICEF, and UNRWA in setting up 2 rounds of polio vaccination campaigns. Polio can be stopped, and we can prevent other young lives from being transformed. We joined the calls for days of tranquility, allowing for the safe and successful implementation of the vaccination campaigns. We also welcome efforts by the Israeli authorities in facilitating the campaigns. As we were reminded today, the humanitarian situation in Gaza continues to deteriorate. And as we just heard from Dr. Ryan, several thousand of patients are in need of evacuation. We repeat our call for full adherence to international humanitarian and human rights law by all parties. We call for full implementation of ICJ provisional measures and Security Council resolutions. We call for an immediate ceasefire. We call for all hostages to be released. And we call for humanitarian aid to be delivered at scale, while expressing our deep concern over the significant drop of aid recently. Despite several disruptions, including major relocations and a dangerous operational environment, the United Nations and the broader humanitarian community continued their work. 2 days ago, another UN vehicle was hit. We condemned the attack. Luckily, WFP colleagues survived because they were in an armored vehicle. This shows the importance of having access to appropriate security equipment, including communications equipment. It also shows the importance of a functioning system for deconfliction. This is not an isolated incident. This Council has not been silent on these 2 points, that is, on required security equipment and on functioning deconfliction mechanism. We issued a joint call on it in February, and in April, we demanded deficiencies to be remediated. Timely information should be shared with the Council on steps that have been taken to remedy these deficiencies. There must be accountability for such incidents. There must also be reinforcement among troops of respect for the rules of engagement and obligations. This includes respect for the UN, its mission, its work, its staff. Mr. President, while we welcome progress related to polio vaccination campaigns, we reiterate that more needs to be done. Civilians must be protected. New threats are looming on the horizon. This war must end. We call on both sides to continue to engage in and finalize ceasefire negotiations. And time is now. Every additional day and delays are counted in civilian lives. By way of conclusion, I also want to briefly touch upon the current situation in the West Bank. We are appalled by the disproportionate use of force, increase in apparent targeted and other summary killings, arbitrary arrests, and sanctioned settler violence, and other human rights violations and abuses. The ongoing operations and any unnecessary or disproportionate use of force must cease immediately. The advisory opinion of the International Court of Justice is clear. Israel's continued presence in the occupied Palestinian territory is unlawful and must end as rapidly as possible. Ideas of evacuations of Palestinians are fueling instability. We remind Israel that appropriate legal frameworks must be applied and that human rights norms and standards applicable to law enforcement must be respected. More violence is not bringing Israel closer to safety and security, and neither international community closer to the two-state solution, which is strongly supported by all members of this Council. Finally, Mr. President, we repeat our call for maximum restraint by all countries and actors in the region. This is not the moment to add more fuel to the fire. Thank you.
I thank the representative of Slovenia for their statement. I give the floor to the representative of Mozambique.
Mr. President, we commend the United Kingdom and Switzerland for requesting this meeting. We also thank the Presidency for convening this urgent briefing. We are also grateful to Ms. Joyce Msuya, Acting Under Secretary General for Humanitarian Affairs, and Dr. Michael Ryan, Deputy Director General and Executive Director for Health Emergency Program at the WHO, for their invaluable briefings to the Council. Mr. President, the ongoing conflict in the Middle East, particularly the occupied territories of Palestine, continues to pose grave risk to civilians. These risks encompass violations of fundamental rights, including access to food, health, and protection. The civilian population face an array of dire threats to their safety and well-being. According to reports, up to August 27, the military operation conducted by Israeli forces have resulted in the loss of over 40,000 lives, with more than 93,000 civilians being injured and more than 10,000 missing. The widespread nature of these attacks has left the civilian population with limited options for safe refugee and has significantly constrained the humanitarian operational space. Furthermore, the persistent activities of Israel settlers in the occupied West Bank, coupled with the ongoing military operation in Gaza Strip, have led to profound human suffering and undermined the prospect for peace and stability in the region. This situation underscores the urgency of international intervention. Mr. President, this situation in Gaza presents extreme challenges for the United Nations personnel and humanitarian workers who operate under very high-risk conditions, with men facing direct attacks while trying to deliver essential services. The chaotic healthcare situation is further exacerbated by attacks on medical infrastructure and limited access to vaccinations, which has created a high-risk environment for preventable diseases like polio. In this regard, the hostility must cease in order to facilitate the intensification of vaccination efforts and prevent a full-blown outbreak. Mr. President, as the international community grapples with the challenges posed by the war in Gaza, it is imperative to advocate for the safety and well-being of civilians caught in the crossfire. Their rights must be upheld, and accountability for any violations must be pursued pursued relentlessly. It is of paramount importance that all parties involved respect international humanitarian law and their commitments under the UN Charter and provide humanitarian relief in this catastrophic situation. Mozambique reiterates its unwavering stance, emphasizing the urgent need for cessation of hostilities, which is a critical step toward achieving both a humanitarian ceasefire. This Security Council bears a collective responsibility to urge the de-escalation in the Gaza Strip conflict. The grave situation demands our urgent attention and concrete actions due to the enormous challenges, harm, and trauma experienced by civilians. Mediation efforts must therefore intensify to address the growing humanitarian crisis in the Gaza Strip. In conclusion, Mr. President, we call upon all members of this Council to work collectively toward the establishment of peace and stability in this troubled region, prioritizing the well-being of civilians caught in the midst of the conflict. We underscore the critical importance of pursuing a two-state solution as the foundation for lasting peace. I thank you, Mr. President.
I thank the representative of Mozambique for their statement. I give the floor to the representative of Malta.
Thank you, Mr. President, and I also thank Acting USG Msuya and Dr. Ryan for their briefings. As we have just heard, the humanitarian situation in Gaza is out of control, with ongoing violations of international human rights and humanitarian law. Over 40,000 civilians, including 16,000 children, have been killed. Others remain unaccounted for. Credible reports suggest the true number could be significantly higher. None of Gaza's 36 hospitals are fully operational due to destruction, overcrowding, and Israel's failure to ensure adequate medical resources reach the Strip. Much of Gaza's population continues to suffer severe food insecurity, and too many are on the brink of starvation. More than 80% of Gaza's educational facilities, including all 12 universities, have been damaged or destroyed. This includes UN schools sheltering displaced civilians, some of which are located inside designated safe zones. A significant proportion of all buildings in the enclave have been reportedly being damaged or destroyed. These include mosques and churches. The suffering we have witnessed over the past 11 months is a direct result of the continued military campaign. Civilians and objects essential for their survival are being actively targeted. UN and humanitarian staff are not spared. UN humanitarian operations currently hang by a thread. Since last October, around 280 UN and humanitarian workers have been killed. Such chilling statistics underline a failure to abide by international law and international humanitarian law. No humanitarian notification or deconfliction mechanism can function in such a context. Equally alarming is the potential outbreak of a polio variant in Gaza, as we have just heard from Dr. Ryan. Malta fully supports the WHO and UNICEF's efforts to vaccinate 650,000 children under 10. Nonetheless, the lack of a comprehensive ceasefire and security guarantees that are assiduously adhered to risks exposing children to unsafe health facilities. It would be remiss of us not to mention the ongoing worrying developments in the West Bank. The dire humanitarian situation, compounded with the ongoing attacks on cities in the northern West Bank as part of Israel's operation, are of utmost concern. It is imperative that international human rights and humanitarian law are upheld at all times. Mr. President, we have adopted 4 resolutions on this conflict since last October. Through them, we have urged the facilitation of humanitarian access, the protection of civilians, and the permanent ceasefire. Despite reports of a ceasefire being close, the political support, armament, and massacres continue. Without accountability, things will not change. However, there is a path out of this nightmare. This starts with the full, immediate, and effective implementation of the relevant Council resolutions and the orders of the ICJ. Security Council resolutions 2712, 2720, 2728, and 2735 unequivocally demand that Israel allows unrestricted aid into Gaza, protects civilians and civilian infrastructure, and agrees to a ceasefire towards a lasting peace. Israel must allow the provision of basic services and humanitarian aid. In closing, Mr. President, we thank and pay tribute to all humanitarian agencies and aid workers for their tireless efforts in such dire conditions. We reiterate our unequivocal call for an immediate and permanent ceasefire and the urgent and unconditional release of all hostages in Gaza. No further delays, diversions, or obfuscations are tolerable. Only then can we begin to address the root causes and secure a just and lasting peace for the people of Palestine and Israel. I thank you.
I thank the representative of Malta for their statement. I give the floor to the representative of France.
Monsieur le Président, je remercie Mme Suya et M. Ryan pour leurs interventions. La situation humanitaire à Gaza continue de se détériorer inexorablement. Elle est devenue intenable. Les agences des Nations Unies et les organisations non gouvernementales ne sont plus en mesure de poursuivre leurs opérations. Les ordres d'évacuation qui se multiplient ont des conséquences désastreuses pour les populations et contraignent toujours davantage le travail des acteurs humanitaires. Il est impératif, plus que jamais, de garantir un accès humanitaire complet et par toutes les voies possibles afin que les populations puissent être secourues, comme le demandent les résolutions 2712 et 2720 de ce Conseil et comme l'exige le droit international humanitaire. La France condamne les tirs israéliens sur un véhicule du Programme alimentaire mondial le 28 août qui ont conduit à la suspension des activités de cette organisation. Israël doit mettre en œuvre un système de déconfliction efficace via des pauses humanitaires et accorder toutes les autorisations nécessaires aux programmes et agences humanitaires. Le démarrage de la campagne de vaccination contre la polio fin août n'est pas négociable. Le désastre humanitaire en cours nous rappelle chaque jour que cette guerre doit s'arrêter. Le rôle de ce Conseil est de rétablir la paix et la sécurité. La crise humanitaire est la conséquence des combats. Y mettre un terme est la seule réponse possible. La France soutient les efforts de médiation des États-Unis, de l'Égypte et du Qatar et elle appelle les parties à faire les compromis nécessaires pour permettre qu'un cessez-le-feu soit mis en place afin que l'aide humanitaire afflue massivement et que les otages soient libérés. Dans un contexte d'extrême tension, la France condamne tout acte de provocation et toute mesure unilatérale à Jérusalem comme en Cisjordanie. Les autorités israéliennes ont la responsabilité de faire respecter le statu quo historique sur les lieux saints en respectant le rôle spécifique de la Jordanie. La France condamne la politique de colonisation. Celle-ci est contraire au droit international. Elle demande à Israël de prendre toutes les mesures qui s'imposent face aux attaques inacceptables de colons contre la population palestinienne de Cisjordanie. La France est alarmée des conséquences de l'opération menée par Israël au nord de la Cisjordanie sur la population et les infrastructures civiles palestiniennes. Elle réaffirme son attachement à la sécurité d'Israël et sa condamnation la plus ferme des attaques terroristes du 7 octobre. Les attaques à la roquette contre Israël doivent cesser. Monsieur le Président, la situation actuelle rappelle l'urgence de mettre en œuvre la solution des deux États, qui est la seule à même de garantir la stabilité et la sécurité de tous dans la région. À défaut, ce conflit continuera et ce Conseil sera confronté indéfiniment à un désastre comme celui auquel on assiste aujourd'hui. La France s'oppose à toute occupation par Israël de la bande de Gaza. Face à la montée des tensions au Moyen-Orient, ce Conseil doit tout faire pour éviter un embrasement régional. La France poursuit ses efforts en ce sens, en lien avec ses partenaires. Je vous remercie.
I thank the representative of France for their statement, and I give the floor to the representative of Russian Federation.
Спасибо, господин председатель. Отмечаем инициативу наших британских и швейцарских коллег по Совету, созвавших сегодняшнее заседание для обсуждения ухудшающихся с каждым днем условий безопасности персонала ООН, работающего в Газе. Благодарим представителя управления ООН по координации гуманитарных вопросов и Всемирной организации здравоохранения Джойс Мсую и Майка Райана за откровенные оценки положения на оккупированной палестинской территории, включая сектор Газа и западный берег реки Иордан. Крайне обеспокоены появлением информации о возможном прекращении работы ООН в секторе Газа. Убеждены, что Совету необходимо сделать все, чтобы исключить данный сценарий, заинтересованность в котором не скрывают отдельные израильские политики. При этом, насколько мы можем судить, сами гуманитарщики полны решимости продолжать доблестно осуществлять свой долг в интересах нуждающихся в Газе. Гуманитарные работники сегодня, по сути, в одиночку пытаются помочь газовитянам выжить в условиях беспрецедентных лишений, вызванных действиями Израиля. Коллеги, какие бы слова о катастрофической гуманитарной ситуации в палестинском анклаве мы с вами сегодня не произносили, все они к без малого году эскалации во многом превратились в бесполезные ритуальные фразы. Пока члены Совета заседают в этом зале и произносят их, за 10 месяцев убиты более 40 тысяч палестинцев, более 93 тысяч получили ранения. Вдумайтесь в эти цифры. Они сопоставимы с населением небольшого города. Эта статистика особенно трагична, если учитывать, что большая часть пострадавших ни в чем не повинные женщины и дети. Никакого проблеска надежды, к сожалению, за это время так и не появилось. Военная операция Израиля продолжается, каждый день умножая жертвы среди мирного населения. Только с 23 по 26 августа вследствие ожесточенных боевых действий убито 170 палестинцев, 390 получили ранения. Очередные приказы Израиля об эвакуации, которых за август насчитывается уже 16, охватили 89% площади сектора и порядка 90% населения. Это само по себе может привести к полному прекращению гуманитарных операций в Газе, даже без выдворения оттуда гуманитарщиков. Примечательно, что под приказ об эвакуации попал и ООНовский гуманитарный хаб в Дейр-Балахе. Именно там, как известно, старший координатор ООН по Газе Сигрид Каг планировала еще в мае открыть свой офис. Это лишний раз подтверждает, что до сих пор усилия по запуску механизма доставки гуманитарной помощи остаются на бумаге, тогда как ситуация на земле во всех частях Газа катастрофически деградирует. Гуманитарщики, выполняющие свой героический долг, работают с постоянным риском для жизни. Отдаем дань их мужеству. 2 дня назад израильскими военными был обстрелян автомобиль ООН с четкими опознавательными знаками. К счастью, ООНовцы не пострадали, однако из-за этой ситуации руководство ВПП по циркулирующей информации объявило о временном прекращении своих операций. Если это так, то ситуация выглядит еще более печально, поскольку тысячи людей не получат необходимое им содействие. Почти все население сектора Газа вынуждено скитаться по территории анклава в поисках хоть какого-то убежища. Но, как неоднократно подтверждали представители гуманитарного крыла ООН, безопасных мест в секторе нет. 2 миллиона человек, по сути, находятся в ловушке, подвергаются обстрелам, испытывают немыслимые страдания от нехватки продуктов питания, воды, медикаментов и ненадлежащего уровня санитарии. Вспышки инфекционных болезней в таких условиях – горькая реальность. Особую тревогу вызывают сообщения о выявленных впервые за 25 лет случаях полиомиелита среди палестинских детей. В первом полугодии в условиях военной операции Израиля прививку смогли получить только 21,5 тысяч палестинских детей, что является самым низким показателем за последние годы. При этом объявленная ООН кампания по масштабной вакцинации находится под угрозой. Несмотря на сложность ситуации, гуманитарщикам удалось доставить в Газу 1 200 000 доз вакцин. Однако интенсификация боевых действий, множащиеся приказы Израиля об эвакуации и ограничения на заезд в анклав медперсонала подрывают усилия по вакцинации сотен тысяч детей, находящихся в секторе Газа. Мы призываем международное сообщество сделать все возможное для предотвращения распространения в Газе полиомиелита и оказать влияние в этих целях на Израиль. При этом важно не допустить того, чтобы необходимость вакцинации от полиомиелита заслонила для членов СБ более важную задачу – добиваться бессрочного и устойчивого прекращения боевых действий. Неуклонно деградирует обстановка и на западном берегу реки Иордан, где ВВС Израиля интенсифицировали силовые рейды. В результате военной операции Цахал в городах Дженин, Тубас и Туль-Карм задействованием тысячи израильских военнослужащих и привлечением авиации были убиты по крайней мере 17 палестинцев. Всего с 7 октября 2023 года на западном берегу реки Иордан погибли 669 человек, включая около 150 несовершеннолетних. Считаем, что международное сообщество должно продолжать требовать от Израиля прекращения как насильственных перемещений и эвакуаций, так и атак на гуманитарных работников с последующим проведением расследований в отношении виновных. Напомню, что в ходе этого конфликта зафиксирована гибель 286 гумработников, из которых 209 человек – сотрудники ООН. И в большей степени речь идет о персонале БАПОР – 205 человек. Однако у нас до сих пор нет никакой информации по привлечению к ответственности виновных в этих преступлениях, если такие расследования вообще ведутся. Господин председатель, мы с самого начала предупреждали, что все гуманитарные резолюции, включая резолюцию 2720, обречены остаться на бумаге, пока в секторе не будет установлено безусловное и всеобъемлющее прекращение огня. Так и произошло. Гуманитарщики объективно не могут работать в условиях активных боевых действий. Они не могут противостоять военным, не могут даже защитить себя, не то что выполнять мандат по оказанию гуманитарной помощи. Совет не имеет морального права требовать от них жертвовать жизнью, не делая при этом ничего для того, чтобы принудить стороны прекратить огонь. Хочу напомнить, что Россия первой еще 16 октября прошлого года внесла проект резолюции Совета Безопасности с таким требованием. Но одна делегация, прикрывая своего главного ближневосточного союзника, как известно, все 10 месяцев блокирует любые реальные шаги Совета в этом направлении. По сути, заставляя всех членов Совета Безопасности стать соучастниками коллективного наказания палестинцев. Ровно неделю назад мы слышали в этом зале очередные лукавые заверения постоянного представителя США о том, что сделка о прекращении огня якобы в одном шаге от заключения, и что все мы должны надавить на Хамас, чтобы она состоялась. Как выяснилось, и это уже никого не удивляет, эти призывы были так же далеки от реальности, как и принятая по американской инициативе 10 июня резолюция по Газе в поддержку так называемого плана Байдена. Россия тогда воздержалась, в то время как остальные члены Совета подписались под заведомо ложным текстом, где утверждалось, что Израиль якобы согласен на предложенные условия сделки. О ее параметрах, к слову, США за все это время ни разу не удосужились пробрифинговать Совет, лишь требуя безусловного одобрения своего кота в мешке и надавить на Хамас. Как оказалось, Израиль не был согласен на эту сделку тогда, не согласен он на прекращение своей операции и сейчас, выдвигая все новые и новые требования, которые в том числе грозят обрушением всей системы договоренности в регионе. А американские коллеги, вместо того, чтобы поставить израильтян на место, к сожалению, этому подыгрывают, модифицируя параметры прекращения огня в Газе в угоду Западному Иерусалиму. Напомню, что Совет Безопасности не давал согласия на какое-либо переформатирование параметров договоренностей, очерченных резолюцией 2735. В итоге даже первый этап деэскалации, прописанный в резолюции 2735, никак не может материализоваться. Не говоря уже о полном выводе израильских войск из Газы и восстановлении разрушенной инфраструктуры сектора. Таким образом, этот документ, который изначально строился на ложном утверждении о согласии Израиля, де-факто утратил актуальность. Теперь нам надо думать над реальными шагами, которые Совет должен предпринять для того, чтобы добиться прекращения огня в Газе, вне зависимости от того, хочет этого Израиль или нет, и обеспечить его выполнение. Все необходимые инструменты в руках Совета есть. Нужна лишь политическая воля для того, чтобы их применить. В противном случае Совет Безопасности ООН ждет незавидная роль статиста в геополитических интригах Вашингтона на Ближнем Востоке, который всячески пытается подменить полноценное решение палестино-израильского конфликта ущербными сделками века при своем единоличном коспонсорстве. Как мы все с вами помним, именно желание США монополизировать ближневосточный мирный процесс и перекроить его по выгодным Израилю лекалам как раз и привело к тем трагическим событиям, свидетелями которых мы являемся. Призываем Совет действовать в соответствии со своим мандатом, а не идти на поводу у США и Израиля. Первостепенная задача – скорейшее и устойчивое прекращение кровопролития в секторе Газа соответствующими механизмами мониторинга по мандату, выданному Совету Безопасности ООН, и при необходимости принуждения к его соблюдению. Это позволит в дальнейшем перезапустить процесс мирного регулирования палестинского вопроса на международно признанной базе в интересах создания независимого суверенного палестинского государства в границах 1967 года со столицей в Восточном Иерусалиме, сосуществующего в мире и безопасности с Израилем. Уважаемые коллеги, каждый день промедления в ожидании результатов разрекламированной двусторонней дипломатии на земле стоит жизни десяткам и сотням мирных палестинцев. Чудес не будет. Ситуация изменит исключительно незамедлительные решительные действия международного сообщества в лице Совета Безопасности ООН. Готовы к взаимодействию со всеми, кто разделяет эти подходы. Благодарю за внимание.
I thank the representative of Russian Federation for their statement. I give the floor to the representative of Algeria.
شكرا سيد الرئيس. بداية أود أن أشكر كل من السيدة جويس مسوع والدكتور مايك رايان على إحاطتيهما الوافيتين، إحاطتان كغيرهما من التقارير تعكس كلها مع الأسف واقعا مأساويا يبين عجز المجموعة الدولية عن ضمان احترام القانون بالأراضي الفلسطينية المحتلة، وتوضح بما لا يدعو مجالا للشك حجم الهمجية والوحشية التي يتعرض لها الفلسطينيون جراء احتلال تخطى كل الأعراف والقواعد. تؤكد الجزائر على أن الوضع الإنساني الكارثي بالأراضي الفلسطينية المحتلة لا يمكن التعامل معه بفعالية إلا من خلال وقف إطلاق النار. لذا نجدد مطالبتنا بوقف فوري ودائم لإطلاق النار ومحاسبة المحتل الإسرائيلي على جرائمه وانتهاكاته الممنهجة والصارخة للقانون الدولي الإنساني، فعرقلت دخول المساعدات الإنسانية واستهداف العمال الإنسانيين ليست سلوكات أو أخطاء فردية، وإنما هي سياسة يتبعها المحتل الإسرائيلي لقتل الأمل في نفوس الفلسطينيين وإدلالهم وتقويض النظام العام بغزة. أمام هذا الوضع الذي يواجه فيه 96% من سكان غزة خطر المجاعة، ويحتاج فيه أزيد من 50,000 طفل لعلاج سوء التغذية، يعطي المحتل الإسرائيلي أمرا بإخلاء دير البلح. إن هذا الأمر هو السادس عشر خلال شهر أوت الجاري، الذي تم فيه تهجير 260,000 شخص من أراضيهم، كلهم هجروا لمرات عديدة. لكن الأمر هذه المرة يتعلق بمنطقة هي مركز عمليات إنسانية، ما يؤكد أن المحتل الإسرائيلي غير أبه بمصير الفلسطينيين ولا العمل الإنسانيين أو الموظفين الأمميين. إنها جريمة حرب مكتملة الأركان، فالتهجير القسري واستهداف العمال الإنسانيين الذين قتل منهم في غزة حتى الآن 297 شخصاً على الأقل، هي جرائم حرب تقتضي منا جميعاً العمل على مساءلة ومحاسبة مرتكبيها. إن العاملين الإنسانيين ليسوا مجبرين على المغامرة بحياتهم لتقديم المساعدة لمن يحتاج إليها، ومن واجبنا توفير الحماية لهم وتمكينهم من القيام بمهامهم النبيلة دون خوف أو تهديد. سيد الرئيس، اليوم نحن نقف على أعتاب البدء في حملة تطعيم أطفال غزة من شلل الأطفال، مرض اختفى من قطاع غزة منذ 25 سنة، لكن آلة الدمار الإسرائيلية تكفلت بإعادته إليه، مثلما كانت سبباً في انهيار المنظومة الصحية بغزة من خلال الاستهداف المتعمد للمستشفيات وللطواقم الطبية. هذه الوضعية تجعلنا ندق ناقوس الخطر، لأن احتمالية انتشار الأمراض والأوبئة أضحت عالية، بما في ذلك الكوليرا، لا سيما مع غرق مناطق من غزة في مياه الصرف الصحي وتكدس النفايات الصلبة نتيجة غياب الخدمات الأساسية منذ بداية العدوان الإسرائيلي. فلا يجب أن ننسى أن العدوان الإسرائيلي هو من أعاد هاجس انتشار هذه الأمراض إلى غزة، وباعتباره القوى القائمة بالاحتلال تقع عليه مسؤولية سلامة المشاركين في حملة التطعيمات ونجاحها، ونحذر من أي عرقلة أو استهداف للمشاركين فيها. وفي هذا السياق تشكر بلادي كل من اليونيسف ومنظمة الصحة العالمية ووكالة الأونروا لدورها في تنظيم هذه العملية وحرصها على ضمان تلقيح ما يزيد عن 640,500 طفل فلسطيني. نقدر صعوبة الظروف التي تعملون فيها، ونحيي فيكم حرصكم على أداء مهامكم برغم كل التحديات. كما تشدد بلادي على الدور المحوري للأونروا في إنجاح حملة التطعيم، فهي متدخلة في كافة مراحل العملية، ومن المتوقع أن 40% من الأطفال سيتم تطعيمهم من خلال الوكالة. إن الأونروا هي العمود الفقري للعمل الإنساني بغزة ولا بديل عنها، رغم محاولة البعض تجاوزها أو تقزيم دورها. فأزيد من 1000 موظف من موظفي الوكالة يشاركون في حملة التطعيم، لكن هذا الجهد المبارك يحتاج وقفا لإطلاق النار، فآليات خفض التصعيد لا تعمل بغزة وهي غير ذات فائدة. لذا نؤكد على أهمية وقف إطلاق النار فورا وتمكين العاملين الإنسانيين من القيام بمهامهم. لا بد لحملة التطعيم أن تنجح، وعلينا ضمان توفير الظروف الملائمة لذلك. في الختام سيد الرئيس، يقع على مجلس الأمن واجب حماية الفلسطينيين ووضع حد لغطرسة الاحتلال الإسرائيلي وإيجاد حل دائم وعادل للقضية الفلسطينية. إن ما يحدث اليوم بغزة من إبادة والتصعيد بالضفة الغربية مع تمادي سلطات الاحتلال في تدنيس المسجد الأقصى. الهدف منها هو القضاء على إمكانية إقامة الدولة الفلسطينية. لذا فإن رد المجموعة الدولية ومجلس الأمن خاصة يجب أن يكون من خلال خطوات عملية وفعالة لضمان إقامة الدولة الفلسطينية وعاصمتها القدس الشريف، النهج الوحيد لضمان سلام عادل ودائم في المنطقة. شكرا سيد الرئيس.
I thank the representative of Algeria for their statement. I give the floor to the representative of Japan.
Thank you, Mr. President. I thank, first of all, I thank the United Kingdom and Switzerland for proposing this timely meeting, and also express gratitude Acting USG Masuya and Deputy Director General of WHO, Dr. Ryan, for their sobering updates. The humanitarian situation in Gaza is beyond description. Repeated evacuation orders have left Palestinians crammed into unlivable conditions, deprived of basic essentials and dignity. The so-called safe zones are nothing of the sort. Humanitarian aid workers and United Nations personnel must be protected at all times. We need to stress this point, especially when we see the vaccination operations are starting. Yet, they are being exposed to intolerable risks. It is totally unacceptable that UN aid vehicles in Gaza continue to be fired upon. Japan deploys a WFP vehicle carrying humanitarian cargo to central Gaza was struck by gunfire earlier this week. This incident has led to the suspension of WFP's vital operations. Clearly, deconfliction mechanisms are still woefully insufficient. We are also deeply concerned that the IDF recently gave just a few hours' notice to more than 200 UN personnel to move out of Deir al-Balah. This has impaired a crucial humanitarian hub at a critical juncture. Mr. President, Japan welcomes the news today of an agreement to a series of short-term pauses in fighting to allow for the vaccination of Gaza's population against polio. All actors must work towards securing the safe and timely delivery of vaccines, especially to children. Yet the start of vaccination does not change the fact that an immediate and permanent ceasefire and massive humanitarian aid are absolutely necessary. We strongly support the joint statement by the leaders of the United States, Egypt, and Qatar, issued earlier this month, and the diplomatic efforts made by these three countries. We call on all parties, especially Hamas, to finally conclude a deal in line with the Security Council Resolution 2735. Failure to achieve one will prolong the agony of all the people in Gaza, as well as the hostages. It also risks further instability, as seen by the Israeli operation in the West Bank that began on Wednesday, and the escalation of the hostilities between Israel and Hezbollah across the blue line over the weekend. We urge all parties, especially those in the region, to exercise maximum restraint. Again, we reiterate the ceasefire must happen now to achieve the release of hostages, the delivery of humanitarian aid at scale, and the calming down of the situation in Gaza and beyond. I thank you, Mr. President.
I thank the representative of Japan for their statement. I shall now make a statement in my capacity as the representative of Sierra Leone. I thank the United Kingdom and Switzerland for requesting this meeting. And I also thank Acting Under-Secretary General Mr. Musuya and WHO Deputy Director General Dr. Mike Ryan for their valuable and sobering briefing, provided in the current context marked by uncertainty and rapid changes in the situation in the Gaza Strip and occupied Palestinian territory. Recent reports from the occupied Palestinian territory convey a high sense of fear and desperation, not only among the Palestinians, but also among humanitarian personnel, who for the past 11 months have been operating under very challenging conditions, with high risk to their safety and security. We are deeply concerned about the reported incident in the West Bank, which continues to be a prime target for the IDF. The IDF's massive military operation yesterday reportedly claimed over 10 civilian lives and left many injured in Tulkarm camp and other locations. The humanitarian situation continues to deteriorate, and operations of the United Nations and other humanitarian personnel are becoming even more challenging. The latest evacuation notice from the IDF to the United Nations on the 25th of August, instructing the evacuation of about 200 personnel from their offices and residents in Del Abalad, a place referred to as a crucial humanitarian hub, has created widespread fear and panic. It reportedly impacts 15 UN and NGO premises, as well as 4 UN warehouses. As briefed by Dr. Ryan, and as rightly stated by the UN and other humanitarian agencies, such actions are especially concerning at this point when the humanitarian community is set to roll out 2 rounds of massive polio vaccine campaigns across the Gaza Strip for over 640,000 children at risk of being infected with variant type 2 polio virus. Also, as briefed by Acting Under-Secretary General Musuya, and as indicated by OCHA, 16 evacuation orders have been released in August only, directly affecting approximately 12% of Gaza's population. In total, since the 7th October 2023 to date, 88.5% of the Gaza Strip have been placed under evacuation orders. And for most areas in Gaza, this has happened multiple times. Persistent hostilities and insecurity continue to aggravate human suffering, create social unrest, and increase trauma, regional instability, and global tensions, with dire consequences for civilians, including women and children, especially the sick, pregnant women, lactating mothers, and their babies. The destructive effect of this prolonged conflict on critical civilian infrastructures, particularly hospitals and medical centers, as well as energy, water, and sewage facilities, coupled with deliberate man-made administrative and physical barriers and obstructions, is making humanitarian interventions increasingly difficult. As stated by Special Coordinator Tom Wennesland in last week's briefing, and I quote, "If these unacceptable conditions are allowed to prevail, humanitarian operations in Gaza will continue to fall short of meeting the massive needs of the population," end of quote. This is now a reality that needs to be corrected immediately. Colleagues, in view of the foregoing, Sierra Leone would like to emphasize the following. Firstly, we draw the attention of parties to the conflict to Resolution 2720, Operative Paragraph 14, amongst others, that state, and I quote, demands that all parties to the conflict take all appropriate steps to ensure the safety and security of UN and associated personnel, those of its specialized agencies, and all other personnel engaged in humanitarian relief activities, consistent with international humanitarian law, without prejudice to the freedom of movement and access, stresses the need not to hinder these efforts, and recalls that humanitarian relief personnel must be respected and protected, end of quote. We therefore condemn the reported IDF attack on a WFP convoy in the Gaza Strip and repeat the need for the establishment of a functioning deconfliction mechanism. Secondly, Sierra Leone strongly support the Secretary General's and other humanitarian agencies' appeal for an immediate humanitarian pause to be observed that will allow for the safe, unhindered, and uninterrupted administration of the 2 rounds of polio vaccine. We also reject all forms of disinformation and misinformation about the potency of the vaccines, which poses a significant threat to public health and undermine global vaccination efforts. Thirdly, we condemn Israel's military operation in the West Bank, particularly since the International Court of Justice has unambiguously declared that Israel's ongoing occupation and accession of the Palestinian territory is unlawful. We remain unwavering in our commitment to ongoing diplomatic efforts, with the hope that with the commitment being exhibited by the mediators, Egypt, Qatar, and the United States, the unresolved differences will soon be addressed, and this will cumulatively lead to a deal that will ensure a permanent ceasefire, the release of hostages, and unhindered humanitarian assistance. Let me close by reminding parties to the conflict to unreservedly adhere to their obligations under international law, including international humanitarian law. We also stress the imperative for accountability. Sierra Leone pledges its full support to all meaningful actions geared towards addressing the immediate and long-term causes of this conflict that will set the stage for a political horizon of a two-state solution with Israel and Palestine living side by side in peace, security, and stability. Thank you. I resume my function as President of the Council. The representative of the United States has asked for the floor to make a further statement. I give them the floor.
Thank you, Mr. President. My apologies for taking the floor once again, but I do need to respond to the remarks made by representative of the Russian Federation. Our Russian colleagues' long-winded statement contained little about the usual politicization of this tragic conflict in Gaza. He rambled on with his usual anti-U.S. rhetoric, sounding like the representative of a bitter, angry, attention-seeking state, which, by the way, is in the midst of a war of aggression against the people of Ukraine in flagrant violation of the United Nations Charter. To be very frank, his country contributes nothing to resolving the conflict in Gaza and seems not to fully understand its complications. So instead, he bemeans the work of the U.S., Qatar, and Egypt, who are trying and working valiantly to end this conflict. So, while he and his government continue the empty anti-U.S. diatribe, we and our Egyptian and Qatari partners will work to bring about a true end to this extremely tragic war in Gaza and bring the hostages home. Thank you, Mr. President.
I thank the representative of the United States for their statement. The representative of the Russian Federation has asked for the floor to make a further statement. I give them the floor.
Спасибо, господин председатель. Я вынужден отреагировать на нервный срыв моего американского коллеги. Мы, конечно, уже привыкли к тому, что Соединенные Штаты во всех случаях пытаются свалить все с больной головы на здоровую, что называется. Но мне хотелось бы, чтобы он предоставил детали На каком основании он утверждает, что Российская Федерация не сделала ничего для того, чтобы предотвратить и остановить конфликт в Газе? Я хочу напомнить, что еще 16 октября прошлого года Российская Федерация внесла проект резолюции с требованием немедленного прекращения огня. 18 октября ваша делегация впервые заветировала такое требование. Всего делегация США использовала вето 5 раз. 40 тысяч жителей, 5 вето. Вот конкретная цена за то, что вы делаете. Вы утверждаете, что вы проводите результативные переговоры по заключению сделки между Хамас и Израилем. Вы действительно их проводите, только они абсолютно безрезультатны. С того времени погибло еще 3000 палестинцев. Это конкретная цена, господин представитель США, цена ваших слов и вашего промедления. Может быть, вы потрудитесь вместо этого хотя бы объяснить нам в этом зале, какие модификации Соединенные Штаты предлагают в сделку с Хамас, которую устраивает в Израиль, о которых мы ничего не знаем. Мы уже неоднократно требуем, чтобы нам была предоставлена эта информация, потому что резолюция 2735 содержит весьма конкретные параметры, за рамки которых мы выходить не должны. Вы все это время водите совет за нос. Будьте любезны ответить.
I thank the representative of the Russian Federation for their statement. The representative of the United States has asked for the floor to make a further statement. I give them the floor.
Thank you, Mr. President. I apologize once again. To my Russian colleague, you have been in this chamber, you or your permanent representative, in all of these discussions. You know exactly what our positions were with regard to each of these resolutions and what we insisted on and what we thought was really going to be necessary to actually make progress in trying to bring an end to this war. So I don't need to sit here and explain to you why the U.S. did what it did with regard to these resolutions. You know quite well. And I think everybody in this room does, because we've been very clear about that. So in terms of what we're trying to do on the ground with our Egyptian and Qatarese partners is to try to take that framework that was agreed by Israel and from what we understand, Hamas, and to try to make sure that we can get full implementation of it. Implementation is the issue here. The framework is there. It's the implementation. And Hamas, at many, many times, has changed its views on some of the steps that were previously agreed on. So what we are trying to do is effectively fill those gaps and work with the parties to do that. So you can sit here and criticize the United States for all the steps it has and hasn't taken, but we have been committed from the beginning and have done more, frankly, than your government has done to try to end this war. And we will continue to work. So you're more than welcome if you want to, sit there and, use another opportunity, as you do at every occasion, to attack the U.S. for this or for that. You certainly, that's your right to do that. But we are going to do the serious work of trying to end this conflict and not sit here and start blaming the world for what's going on. This is a very, very deep and challenging and long-standing conflict, and we are working and have worked harder than your government has at any point to try to end this overall conflict. So my recommendation to you and your government would be, if you're going to contribute something positively, then contribute it. If not, you should be quiet. Thank you.
I thank the representative of the United States for their statement. The representative of the Russian Federation has asked for the floor to make a further statement. I give them the floor.
Я хотел бы сказать уважаемому коллеге американскому, чтобы он свои рекомендации мне и моему правительству оставил при себе. И, наконец-то, занялся тем, чем Соединенные Штаты должны заняться. Не мешать Совету Безопасности работать над урегулированием палестино-израильского досье. Все в этом зале прекрасно понимают, что именно Соединенные Штаты несут основную ответственность за то, что происходит в Газе сейчас. 40 тысяч жителей – это убитых. Это не просто аморфные цифры. Это конкретные человеческие трагедии. И если у остальных моих коллег не хватает смелости сказать вам это в лицо, то у меня с этим проблем нет. Вот и живите с этим дальше. Спасибо.
I thank the representative of Russian Federation for their statement. There are no more names inscribed on the list of speakers. The meeting is adjourned.